My name is Jonathan Abuga, and I am the first author of a recently published paper in Developmental Medicine and Child Neurology, which was published on 18th of September 2021. My current work focuses on changes in the burden of neurological impairments and disability in African children here at the program, and I have a background in epidemiology and biostatistics. From the early 2000s, we were interested in knowing whether the prevalence and risk factors for neurological impairments and disability are changing in African children. So back then, here at the program and the area surrounding this place, the prevalence of malaria was high. And also the referral hospital, known as Kilifi District Hospital then, recorded a high admission rates for adverse neonatal events, which are known risk factors for neurological impairments and disability. And in the last decade, there has been a significant improvement in under 5 mortality and also perinatal services. And more mothers are now attending maternal services, as well as more babies being born in hospital. So we were interested in assessing whether the prevalence and risk factors have been changing over a period of improved child survival and differential changes in non-risk factors. So we conducted 2 surveys using similar designs, so 2-stage designs. So the first survey was conducted in 2001 and a repeat in 2015. So in the first phase, there was assessment of neurological impairments using a simple tool in the community by a trained community assessor. And the tool which was used is the 10-question questionnaire. So all children who were tested positive and a random sample of negative controls were invited to the Research Center for Comprehensive Assessments in the second phase. So we assessed children aged 6 to 9 years, and the justification is that at this age, the outcomes of adverse perinatal events or birth events are more apparent. And we also had sufficient and well-validated assessment tools for this age group, as well as these school-going children might be targets for mass interventions. So we also assessed the admission rates with adverse perinatal events, including low birth weight and preterm births, as well as neonatal encephalopathies between the 2 survey points. So getting to the main results is that the overall prevalence declined significantly for any of the 5 domains that we assessed, from 61 per 1,000 to around 45 per 1,000, predominantly in the domains of epilepsy, hearing, and motor impairments. And it is possible that the risk factors for these 2 domains remain unaddressed. In addition to that, there was little evidence of spatial or geographical clustering in either surveys. And concerning the risk factors, there were differential changes in the significant risk factors depending on the domain of impairment, as well as the year of survey. So in summary, adverse perinatal events and undernutrition were significant risk factors for both surveys in 2001 and in 2015, looking at the 5 domains that we assessed in the surveys. Then considering the risk factors, because I've previously mentioned that we also assessed, we did surveillance of the hospital data. So from this data, we observed that the annual admission rates ranged between 6 and 8% for preterm births, low birth weight, and neonatal encephalopathies. So over time, the annual admission rates with these risk factors has been increasing. So we would recommend that going forward, we have promotion of hospital-based deliveries as opposed to home deliveries, as these will allow monitoring of these adverse perinatal events. Secondly, there is need to improve prenatal care, neonatal care, and postnatal care. I will talk about a continuum of care for maternal and child services for expectant mothers as well as for the newborns. And then there is also need to continue control of childhood infections, especially malaria and meningitis, and other infections that are known to adversely affect the brain development at this critical stage of child development. In addition to that, there is also need to address household food security. As you have observed that undernutrition was an important predictor of neurological impairments and disability in both surveys, in addition to adverse perinatal events. And also it's important to look at other determinants for disability, including poverty as well as literacy, especially for the mothers. So there is also need to sustain rehabilitation or support rehabilitation and provision of assistive devices for those with impairments, as this will improve the quality of life of the affected children, as well as reduce the probability or the risk of premature mortality, because in a previous study we've already identified that such children have a higher risk of early deaths. And then finally, there is a need for future studies, as this will keep track of future changes in the prevalence and risk factors, and it will be able to provide the required evidence that will inform policy or future research activities, as well as inform action, especially public health interventions.